What is Premarin? Is it safe? Premarin is a form of hormone replacement therapy that is derived from the urine of pregnant mares, horses, hence the name Premarin. It has been sold for over 50 years, so you may have had a mother, grandmother, or aunt who took it, or you might even be taking it. It used to be the top-selling menopause drug in America, over $2 billion per year. But the body of evidence is now overwhelmingly pointing to a connection between the use of Prempro and invasive breast cancer in women. In fact, over 10,000 lawsuits have been filed against the drug's manufacturer. Prempro is a combination of Premarin and Provera, a synthetic progestin. Now, Premarin is called natural because it comes from a horse. But unless you eat hay for dinner, it is not natural to your body. Let me explain. The human estrogens are three: estriol, estradiol, and estrone. Horse estrogen contains only one human estrogen, estrone, plus 3 estrogens found exclusively in horses. These are called equine and equine estrogens because equine is the word for horse. These horse estrogens are much more potent and longer lasting than those produced by women. Your body doesn't know what to do with the horse hormones that are in Premarin. They don't follow the normal hormone pathways and are not excreted naturally like the human hormones. If you take Premarin, the levels of the equine in it can remain elevated for 13 weeks or more, even if you stop, because of storage and slow release from your adipose, which is your fat tissue. Another metabolite of equine has been extremely potent for inducing endometrial growth, so that's a possible precursor to cancer. It's also not kind to your thyroid. When Premarin was the #1 selling drug in America, guess what was #2? Synthroid for your thyroid, because the Premarin negatively affected the thyroid gland. Now, one woman asked me, "Barbara, how do they collect horse urine?" Well, brace yourself. Mares are impregnated. Then for most of their 11-month pregnancy, these horses are confined to stalls that are so small they can't turn around or take more than one step in either direction. And they have to wear these rubber urine collection bags at all times that chafe. Ouch! And their drinking water is limited, so the urine will contain more concentrated estrogen. And then once their foals are born, they're taken away and the mares are re-impregnated. And this cycle continues for about 12 years. Yikes. Well, American courts have dealt with Premarin lawsuits for years. The manufacturer has paid over $1 billion to settle over 10,000 claims. But they still do not admit liability. But you do the math. Why did they settle? Here's an example. In 2007, a jury found Prempro caused cancer in a woman who had only taken it for 2 years and awarded her $1.7 million. Premarin and Prempro remain on the market, but now they contain strong warnings and are prescribed in lower doses. But doctors are still prescribing them. Why, you ask? Well, it's not because they're superior to other available therapies, but it's because doctors are told they are superior. They are told by the company with the huge advertising budget who has a lot to lose if a doctor prescribes a different estrogen. Now, we're wiser. Now we have the facts. As for bioidentical hormones, you are not a horse, and you can refuse horse-derived hormones. If you have a caring doctor, he'll find something else for you. By the way, in addition to breast cancer warnings, now the little safety thing that you get with the drug lists other side effects, including coronary heart disease, gynecologic cancers, and dementia. So you don't have to fight. Just ask your doctor for bioidentical hormones. The ones usually given are estradiol and or estriol, not the estrone that's the one in Premarin. Because it has been around so long and so many women have heard of it, it's considered to be safe. You make up your mind, but for you to know, there are other alternatives. We don't eat bales of hay for dinner. We don't want horse hormones. Do you know someone who's on Premarin and you think maybe they'd like to get off? Well, look what I have for you. Weaning instructions from Harvard Medical. Write to me and I'll put this in your hands.